Dr. Atkinson. Thanks
Parker.
for joining us in Austin this weekend for training. It's been a great weekend so far. I wanted to talk to you about what you said earlier, and as we think about community involvement with Minuteman, you made a great point talking about, hey, if you're interested in maybe onboarding this therapy into your practice, it's important to talk to your community surgeons. Tell me how you've gone about that and why that's important to you.
So not even for just this therapy, always having a healthy dynamic between you and your surgeons is fully recommended. They're going to be there for emergencies, they're going to be there for questions, referrals, any and all things. But particularly with this product, I recommend having a conversation before you bring it in, right? Make sure they understand what it is, make sure they understand the clients or the patients you're picking in the population, and just be open-minded with that conversation. Sometimes they may get a little defensive, but at the same time, as long as you have a healthy dynamic and you maintain that open dialogue, things will typically work out for the best, mainly for you and your patients.
Yeah, I love that because it's respecting the two different skill sets, right? Patients that you're seeing, I imagine, are probably a little older. They definitely don't have like a 3 to 5 millimeters of translation. It's a grade 1 spondy,
Right.
Probably more of a mild stenosis, stenotic patient.
Correct.
But we want to refer those out that have a grade 2, and so I know you're thinking through that.
Correct. So any significant translation, you always want to refer out, have a surgeon take their eyes on it and look at and make sure that they're not a candidate for something that's needed more significant. Now that's not to say that those cases don't always come back and they're not candidates for something like Minuteman, because they still are. But for the most part, make sure you have all your bases covered beforehand. And again, this therapy is something that's supposed to really bridge between two parts that have, therapy-wise, that have been missing. So we do epidurals, minimally invasive things, and the larger scale spine surgeries. Historically, there just hasn't been anything to meet those two and bridge that gap. I think this is a fantastic product that allows you to care for your patients on a level that we haven't been able to do for years.
Amazing. Thanks for your time, Dr. Atkinson. Well said.
Appreciate it.